We'll just give everyone a couple minutes to join. All right, we will go ahead and get started. Well, good evening and welcome. My name is Julian Gutierrez. I'm the social media manager at UNM Health. On behalf of UNM Health, I thank you for taking the time to join us this evening for our COVID and vaccine town hall. It is my pleasure to serve as your host and moderator this evening. We are hosting tonight's town hall because we understand that pregnant individuals trying to get pregnant or anticipating being pregnant have questions and concerns about COVID and the vaccine. Our goal this evening is to provide science and fact-based information and answer your questions to the best of our ability so you can make an informed decision. But first, a few housekeeping items to ensure everyone's participation goes smoothly tonight. We have participants joining us this evening via Zoom and by phone. Please note that we are also recording this town hall, so it will be available for on-demand viewing on both our UNM Health Sciences YouTube and Facebook pages. We will be hearing momentarily from our presenters. Following from the presentation, I will open the program for questions and answers. So for those of you joining us via Zoom, please take a look at the bottom middle of the screen where you will see a Q&A icon. If you would like to ask a question during the Q&A portion, please submit your question via that icon. I will share the first name of the person submitting their question and then ask those questions in the order that they are received. If you would like to remain anonymous, please also check the anonymous button when submitting your question. We have also invited the community to submit questions in advance. So as time allows, we will be including and incorporating those questions into the Q&A portion of the program. So it is now my pleasure to introduce you to our presenters. We are joined this evening by Dr. Trevor Quiner and Dr. Borders. Dr. Trevor Quiner is currently completing his maternal-fetal medicine fellowship at the University of New Mexico. He has a special interest in research and quality improvement projects in addressing the extra challenges of high-risk pregnancy and high-risk pregnancy care in rural settings, emergency pregnancy transport, and education. And Dr. Borders is a certified nurse midwife and chief of the midwifery group at UNM. She has a special interest in quality improvement of systems that positively impact patient care and teamwork. And she is also committed to improving and changing culture in work settings to build highly collaborative and interdisciplinary teams. At this point in the program, I will hand the presentation over to our presenters. Thank you.
Thank you very much, Julian. Share the screen. All right. We're grateful for the opportunity to share some of our, increasing understanding of pregnancy and the COVID-19 vaccines. We understand that this is an area where there's lots of desire to know more, and there's still some areas where we don't have all the answers, but I'm grateful to say that we're learning more and more. Before we get started, I just wanted to make sure to let everyone know that neither myself or Dr. Borders or Dr. McGuire, if she's able to join us, have any compensation or any other benefits from any vaccine companies and have no vested interest in the use of vaccines beyond the public health. So just to briefly discuss, the importance and significance of COVID-19 during pregnancy, where we started last year with a very minimal understanding of this new disease, until now has changed quite a bit. We now know that pregnancy significantly increases a person's risk for having a severe COVID-19 infection. We know that increases their risk for having an ICU admission and even in dying from COVID-19. Additionally, some of these very specific pregnancy complications are increased during COVID-19 infection, including preeclampsia or eclampsia, this high blood pressure related diseases of pregnancy, as well as the risk of preterm birth, whether spontaneous preterm birth, where it starts on its own, or preterm birth that's required due to the illness of the mother. Additionally, and mostly in part, mostly due to this risk of prematurity, is that there is increased risk to the newborns of mothers with COVID-19 that are less related to that transmission, but by the whole situation that it causes. So we wanted to start talking about the vaccines with a little bit of a high school biology lesson. On how immunity works and how antibodies works. So our bodies have the wonderful ability to develop immunity towards diseases so that we don't have to experience them over and over. And that starts when the body's immune cells identify abnormal disease-causing particles and capture them, then fragment those either whether they're viruses or bacteria or other things, and then display the pieces of those disease particles and show them to other immune cells. These cells are then able to create antibodies, displayed here as these little Ys, that are special proteins that can identify and bind to the fragments of disease particles and help with destruction of those diseases. In this case, we're talking about COVID-19. And so antibodies are able to develop towards different parts of the COVID-19 virus or SARS-CoV-2, and then the body's able to fight off that disease. With vaccines, we attempt to get the same benefits of immunity or better immunity by avoiding the infection, but either introducing fragments of the virus or other disease-causing pathogen, or presenting the body with weakened forms of the disease. In the case of COVID-19, all of the vaccines so far have used the spike protein fragment as the target for these vaccines. Immune cells take up the fragments, and then similarly, antibodies are able to be made to target those specific fragments or proteins, and then help with destruction of the disease-causing particles. In the case of COVID-19, the goal is to attack these circulating small numbers of viruses before it can cause a significant infection. And so one of the important things that we've learned during this pandemic is the mRNA vaccines. And these are the vaccines that are created by Pfizer and BioNTech and Moderna that we hear so much about in the news, and that are the primary vaccines being used in the United States and much of the world. And so it's important to understand a little bit of the lingo around these vaccines. In our bodies, we have our genetic code that is essentially the master plan for all of the things that make up our bodies. All the proteins that make our bodies function are encoded or kept as master plans in DNA. As our cells are making these proteins, the body copies the relevant portions of the DNA into the mRNA, which act kind of like copies of the plan, which are then used to produce the finished proteins that our bodies need. This would be equivalent to having a master plan for a specific design of a chair, for example, and then in a factory to have different copies of the plan at each workstation that represents the mRNA to eventually allow the production of the actual chairs that can be sat upon. And so how do these mRNA vaccines work? Well, the mRNA vaccines are made up of the specific mRNA that allows the creation of the spike protein that we hear so much about in the news of COVID-19, and a capsule that allows it to be delivered into our body's cells, mostly in the muscle and immune cells of our arms. The vaccines are able to deliver the mRNA into the cell. This mRNA, or these copies of the plan, do not go at all into the nucleus of the cell where our DNA is kept, but instead are moved over to these areas called ribosomes that allow the creation of the proteins based on the plans that are encoded in the mRNA. These spike proteins, which are the ones derived from the COVID-19 virus, are then able to be displayed or released into the body, where other immune cells can take up these proteins and then develop antibodies to match the spike proteins. This has allowed the body to produce this antibody response without having to be infected by COVID-19, with all the resultant significant risks and of significant disease and death that can be associated. The other vaccine that is currently being used is the Johnson & Johnson vaccine, and it is a little bit different than the Pfizer and Moderna vaccines. The Johnson & Johnson vaccine is called a virus vector vaccine because instead of using mRNA and a kind of an envelope to carry that, it uses a specially designed cold virus, adenovirus, to deliver the DNA for the spike protein into our body's cells. Now, these virus particles are built so that they cannot reproduce and cause infections like normal viruses can. Their only job is to get this DNA into our body's cells. In this case, the DNA for the spike protein goes into our nucleus, where the rest of our DNA is held. Our body then copies this into the mRNA, or the copy of the plan. And then similarly to the other vaccines, this mRNA is used to produce the spike proteins that cause that immune response and the creation of our protective antibodies, as well as other protections. So what's the differences in the clinical efficacy of the vaccines? We certainly have a little bit more information about the Pfizer and Moderna vaccines right now, as they've been in use longer. But the efficacy appears to be very good, with the Pfizer vaccines and the Moderna vaccines having about this 95% efficacy based on the trials that were done to show that they work. As they have used these in real life situations with millions of doses throughout the world, we're seeing that the overall efficacy is about 90% in preventing symptomatic disease, and even stronger, in some cases 95 or 100% in preventing hospitalizations, severe disease, and death. The Pfizer vaccine requires 2 doses, as everyone's very familiar with, given 3 weeks apart. And the Moderna vaccine also requires 2 doses that are given 4 weeks apart. Now, the Johnson & Johnson vaccine, in its study, which was several months after the Pfizer and Moderna vaccines, showed about 72% total efficacy in preventing symptomatic disease, or disease that causes symptoms, and 86% effective in preventing severe disease or death. One of the benefits of the Johnson & Johnson vaccine is that it only requires a single dose to provide that benefit. I'll turn over to Dr. Borders to continue talking about the information that we do know about these vaccines in pregnancy.
Great, thanks, Dr. Quiner. Can everybody hear me okay? Okay, great, thanks. I had to go between 2 different screens. So the next slide is about just are the mRNA vaccines safe in pregnancy? So this is a question that we hear all the time. Dr. Quiner, myself, Dr. McGuire, and all the providers at UNM. Pregnant people are just really concerned. Of course, they want to make sure this is safe for themselves and their pregnancy and also for their growing babies. So it is important to know that pregnant people were not originally included in the trials for any of the vaccines. But when the vaccines were approved, the FDA did set up several methods to track vaccine safety in pregnant people. And the other thing that's important to note too is that even though people may not have known they were pregnant, early on, a lot of people don't know they're pregnant. So there definitely were some people, not many, but a few people who were pregnant when they got the vaccine and they just didn't know it yet. And those people were tracked like everyone else was who signed up to be tracked. Go ahead, Dr. Quiner. So we now know, though, that the Centers for Disease Control and the Food and Drug Administration have collected information on over 35,000 pregnant people, including detailed information from, sorry, my screen is cutting off the numbers there, from 3,958 people. So we do now have a lot of information on pregnant people who've received the mRNA vaccines. So that's the Moderna and the Pfizer. And what we know is that the information they've collected is about pregnancy complications, side effects, and pregnancy outcomes on these vaccines. So compared with normal rates of pregnancy loss, preterm birth, and other pregnancy problems, there were no real differences in those who received the vaccine in pregnancy and who didn't. And importantly as well, pregnant women ask, well, does this affect the babies, the rate of birth defects if I get this early in pregnancy? And no birth defects have been reported either. So that's all very reassuring. So side effects in pregnancy. Women also ask, are my side effects going to be worse because I'm pregnant? I get my asthma sometimes worse, and I get worse allergies. Is the vaccine going to feel worse for me? Pregnant people who are vaccinated, have similar or lower levels of side effects. So really nothing more. So you don't have to worry about being pregnant, getting the vaccine, and feeling worse than you would otherwise. Tylenol should be used as directed if a fever occurs as a side effect. We don't necessarily recommend taking it before you get the vaccine. There's really no recommendation either way. We don't have great information on that. So you only need to take Tylenol if you have a low-grade fever or aches, like you would do normally, but you shouldn't take it prior to getting the vaccine.
There are some questions that have been asked that we'll answer at the end of the presentation based on timing of taking the vaccine, if you were to choose to, and whether or not to use Tylenol or what to do with fevers, and we'll address that a little bit more.
And so the other really important information is, are they effective, these vaccines? Is it worth the trouble, and is it worth all the heartache and the questioning myself about getting it? Several small studies have actually just published recently have shown that pregnant people have similar antibody levels to people included in the original studies. So the antibodies, again, the bodies in our body that fight off diseases, they're about the same level as people who aren't pregnant. So that's really important. And new information also shows that pregnant women who are vaccinated can actually pass these antibodies to their babies, which may help protect the babies from COVID-19. So that's a great extra bonus that we didn't know about prior to these studies. So that's super important. And so the Johnson & Johnson vaccine, we still don't know as much about this vaccine as Dr. Quiner said, because it's newer. We do know that the same level of information is just not quite available. However, the way the vaccine works should be safe for pregnant persons. And the same type of vaccine that the Johnson & Johnson vaccine has been used to fight other diseases that have been studied in pregnant people and have been found to be safe. So we have no reason to believe that it's not safe or effective for pregnant people. Breastfeeding, as far as the COVID-19 vaccine is concerned, there are no problems related or reported with breastfeeding and vaccines. And the other good thing is that vaccinated people can pass antibodies on to their babies in breast milk. So that's another good plug there for breastfeeding, but also for COVID-19 prevention. So should pregnant people be vaccinated? As with almost any decision in pregnancy, all of our national societies, the Society for Maternal-Fetal Medicine, the American College of Obstetrics and Gynecology, American College of Midwifery, of nurse midwives, everyone supports each person's choice regarding getting the vaccine in pregnancy. And so in making a decision, like many decisions in pregnancy, we have to consider certain options or certain choices and also certain factors. So we always need to remember that the risks of COVID-19, as Dr. Quiner pointed out very much in the beginning, are not great. The risks are really high. And so it's important to always think about whether you want to get the vaccine or whether you want to get COVID. And often the vaccine has a lot less side effects than COVID does. So always something to remember. And the information available about safety in the vaccine. So that's ongoing. We're going to get more and more information. So it's really important to keep up with that information and talk to your doctor or midwife about that. And then again, also potential immune benefits to the newborn after birth. We are just beginning to learn about that. And that's also really important to keep in mind. So lots of things to think about when you're considering whether to get the vaccine or not. Another question that we often get, or you may have heard about through social media, people have worries about fertility and getting the vaccine. So there are no reports of people having difficulty getting pregnant after getting the COVID-19 vaccine. And there are also no reasons why the COVID vaccine would interfere with being able to become pregnant. So both of those things are important to emphasize.
Furthermore, some reports in social media or otherwise of the ability of people who have been vaccinated to somehow shed some sort of influencing anything is really not founded in any scientific fact, as the vaccine is unable to reproduce itself or cause any other problems in that manner.
And getting COVID-19 also, the actual disease can cause, contributes to preterm birth. So I think that's also really important to remember. And as always, the doctors and midwives at UNM in the Department of OBGYN are happy to provide more information and answer questions. And I think we'll go ahead and address some of those questions now, right, Dr. Quiner?
Thank you so much. So yeah, thank you again, Dr. Quiner and Dr. Borders, for your informative presentation. So we have now reached the Q&A portion of our program. Again, for those joining by Zoom, please look at the bottom middle of your screen where you will see the Q&A icon. Please submit your question via the Q&A icon, and I will read the first name of the person and their question. And if you would like to remain anonymous, you may do so by checking anonymous when submitting your question. And we've also incorporated a few questions that were submitted in advance of tonight's event. I'll read those questions and pose them to our experts, and they will answer your questions to the best of their ability. So I'm going to go ahead and kick us off with our first question. And Dr. Quiner, if you don't mind unsharing the screen, please. Thank you, sir. All right, so our first question is from Jessica, and her question is it certain that the Pfizer vaccine has no interactions with the placental proteins? Has there been any increased risk for miscarriages after receiving the Pfizer vaccine?
All right. So this question has a couple of different answers. First, in the original studies about the vaccine, some of the only pregnancy-specific information was based on taking the vaccine and exposing it to placental cells to see if there was any extra binding, so that the antibodies are binding to the placenta as if it was a disease particle. And there were no such types of binding. There was no abnormal binding between antibodies created by this immune response, or by the vaccine itself, which is not surprising, as it shouldn't happen that way. As Dr. Borders mentioned, in the Pfizer vaccine trial, there were about 7 people who received the vaccine right before or in early pregnancy. And there were no miscarriages noted in that group. The only miscarriage noted in the original Moderna or Pfizer vaccine studies was in a woman who received a placebo, so a non-vaccine containing treatment of just the salt water. Since then, as Dr. Borders presented, we've had these registries and other systems set up to watch for any increased risk of miscarriage, especially. So people who have been vaccinated who are pregnant have reported when they have miscarriages. And also the CDC has specifically called people on the phone who reported that they were pregnant and asked them if they've had any miscarriages as well as other pregnancy complications. They've taken all that information and compared it to the amount of normal miscarriage that occurs in pregnancy in that number of people. And there is no increased amount of miscarriage in people who have been vaccinated with the Pfizer vaccine or the Moderna vaccine that we have been able to see so far.
Thank you, Dr. Quiner. All right, so I'll go ahead and move on to our next question. This question is anonymous. So, would it be better for me to wait until the second trimester to get vaccinated, or should I get vaccinated sooner?
This is another great question, talking about the timing. The current trials that are being done by Pfizer and Moderna in pregnant persons are being given in mostly the second and third trimester. We don't have any specific evidence of problems that are caused from people who got their vaccine in the first versus second or third trimester as far as miscarriage, stillbirth, or other pregnancy complications. We see no differences. The only thing to think about is, though we have no reports of any kind of birth defect, almost all birth defects occur in the first trimester. And so for those who decide that they want to be the most cautious, they could avoid the first trimester as being that highest risk period, though we haven't seen any problems, and be vaccinated in the second trimester. The other thing to bring up there is that in some studies, high fevers, much higher than is normally seen in the side effect for receiving the vaccine, have been associated with birth defects when people are not taking folic acid and not using things like Tylenol to bring their fevers down. And so that would be our only recommendation, is especially in the first trimester, but throughout pregnancy, if a vaccine side effect of having a fever occurred, it's very appropriate to use acetaminophen, as is written on the back of the bottle, to bring that fever down as an abundance of caution to prevent, the many risks associated with fevers by themselves. But as far as timing, that is still everyone's choice. An ability to isolate the current spread of the disease, all these things are important factors to think about.
Thank you very much for that answer. And another question for both Dr. Quiner and Dr. Borders. This is also anonymous. I am 2 weeks postpartum and I had a C-section, so I was waiting a little while to heal and get cleared at the 4-week postpartum checkup, as I'm concerned about the side effects of the vaccine. I think you kind of actually just covered this. Any thoughts on the appropriate timing or things to consider? So do you have anything to add to what you've already said on that?
Recovering from a C-section should not make the vaccine less effective, nor should that make the side effects any worse. It is certainly everyone's decision whether to compound the possibility of these overall mild side effects with the discomfort and pain from recovering from a C-section. But certainly sooner immunity that can also be passed on possibly by breastfeeding would be something else to think about and not delaying vaccination.
And you certainly are already fatigued postpartum, so you may be more fatigued if you get the vaccine. But again, I think the benefits outweigh the risks, as Dr. Quiner said.
Thank you very much. So our next question is from Emily. If you tested positive for COVID, is it safe to get the vaccine now? Is there any chance your body will have a more intense reaction to the vaccine if you recently had COVID? So non-pregnancy related question, but I think still important.
Most of the reason that the FDA and others have recommended postponing using the vaccine for 90 days or so after COVID infection is that there does seem to be an amount of immunity that occurs with infection from COVID that lasts for at least about those 90 days, and a desire to make sure that the most vaccine is available for those who have not yet been infected. Guidance may change on that, and I wouldn't be surprised. Anecdotally, there are reports of increased, and even in the original studies, that there is an increased risk of side effects, not necessarily worse side effects, for those who have already been exposed to COVID through infection, which isn't surprising that the body's able to mount a little bit more of a response against the vaccine since it's been exposed to the original disease beforehand. But no report of anything that is causing hospitalizations or death or anything like that due to vaccinations, even in those with COVID previously.
Great, thank you very much. Our next question is also anonymous. Dr. Borders and Dr. Quiner, can you please comment on vaccination recommendations for breastfeeding mothers? Thank you.
I mean, I think that's we covered this a little bit, but I think if you get the vaccine when you are pregnant, or even if you wait till you're breastfeeding, again, you're not only going to have the antibodies for yourself, but you also pass those on to your baby. So you're going to give your baby protection as well. So it's kind of a double armor, so to speak. And the side effects for the mother, I mean, we've gone over that. So I think that, again, it's seems to be efficacious and highly effective for breastfeeding moms, and that added benefit of protecting your baby, which is really important for all parents.
Thank you. And I think you guys may have touched on this question a little bit as well, but I think it's worth asking anyway. Does using Tylenol decrease a fever while pregnant? To decrease a fever while pregnant definitely decrease the risk of birth defects. If I were to have a vaccine in the first trimester, but then take Tylenol, is the risk totally mitigated?
We can never say definitely or totally in anything in medicine, unfortunately. However, when we look at the studies that have shown, have looked at whether fevers cause an increased risk in birth defects, the first question is not all of those studies show a consistent problem. So I don't know if we can say for sure that fevers cause birth defects. However, in some of the larger studies that did show an effect from fevers, that seemed to be lessened by those who used acetaminophen or Tylenol to decrease their fevers, or those who are already taking folic acid supplements also had none of those side effects, I'd say birth defects. So I can't say definitely, but I would recommend using it as a precaution in cases of fever. And Tylenol, even in early pregnancy, acetaminophen has been shown to be very safe for this purpose.
Thank you very much. Moving on to our last two questions. So I'm scheduled for my vaccine this weekend, but there is a small chance I could be pregnant. Should I go ahead and get the vaccine anyway? I'm concerned about getting a vaccine that has not been thoroughly studied in pregnant women, but I'm also concerned about getting COVID while pregnant.
I think one of the key parts of this question is the acknowledgement at the end. I'm also concerned about getting COVID while pregnant, because that is a very significant issue. And we unfortunately are learning more and more, as we touched on briefly, about how strongly COVID-19 can affect pregnant people. It's still a personal choice whether to take a first opportunity early on to be vaccinated or to wait until later, during or after pregnancy. But I would say that that's the appropriate question to be thinking about. Is this worth what overall is appearing to be very small risk, as we've shown a lot of safety information lately, versus the large benefit of being protected against COVID, which has known harmful effects during pregnancy? The CDC and FDA and all the societies do not recommend about testing for pregnancy prior to being vaccinated. That's all just a personal choice.
Thank you, Dr. Quiner. So we have got a couple more questions. So our first one is anonymous. Have there been any known occurrences of menstrual period changes after vaccination?
So there have been cases of not just with COVID-19 vaccinations, but with other vaccinations and having side effects afterward that have included menstrual irregularities. We haven't demonstrated any increased risk of problems with fertility or long-term menstrual effects due to vaccines, specifically also with the COVID-19 vaccine. Dr. Borders has also looked at this fairly recently, and in COVID-19 infections, especially with these long-term infections or the long haulers, there seems to be a much higher risk of long-term menstrual difficulties.
Thank you for your question and answer. So our next question is anonymous. I'm afraid of birth defects. Does it make sense to wait until the second trimester to get vaccinated because I can mostly isolate?
So as we touched on a little bit before, it's a very personal decision. Being outside of the first trimester decreases risk of birth defects from any cause substantially, as most of the baby is formed by about 12 weeks of pregnancy and is simply growing in size afterward. And so again, if one's able to isolate and has that specific concern and wants to have an abundance of caution, that is an appropriate choice to make.
Thank you very much. And maybe our last question. The Tdap vaccine is given to pregnant people at a specific time to increase immunity in the baby by the time they are born. Is there indication for an ideal time for a pregnant person to get the COVID vaccine to give the highest immunity to the baby? Do any studies indicate just how much immunity a baby has after their mother has been vaccinated?
A very astute question. I can't say that we can answer this completely right now. The studies that have shown that babies that most babies or some babies of vaccinated mothers have antibodies in their blood at time of birth showed that most babies of vaccinated mothers did have that response. However, those babies whose mothers had only recently, within the prior 2 weeks, been vaccinated had either lower numbers or did not yet show those antibodies in their blood. And so we don't know for sure, and we'll likely have more information in coming months, but it's likely to be very similar to the Tdap vaccine, which we recommend be given about 28 weeks of pregnancy to allow the body to have its full immune response to create the antibodies to then be passed to the baby. But I can't say for sure if there's a specific time that will I make those levels ideal. Additionally, we haven't proven that those antibodies protect baby, but science and logic would indicate that it's likely going to provide them some protection, as it does for, in the case of Tdap, especially the whooping cough or pertussis and the flu vaccines.
Thank you very much. So I don't see any other questions. I'll give it just a moment here to see if anyone else has a question.
I think another thing to consider is so much of the decision whether to get the vaccine or not, as we've pointed out, is it's really about a personal choice. You know, people have different tolerances for risk, you know, one way or the other, either risk for vaccine side effects, and I think that it's just all plays into the decision that a person makes. And so it's the other thing that I've been quite amazed about is, you know, every human reacts differently. And I think if the pandemic has really driven home to me how complicated the immune system is, and every person that gets COVID is going to react differently. Some people have no symptoms. Some people end up in the ICU, and we still can't accurately predict who that person will be in either of those categories. And the other thing that Dr. Quiner touched on is this long hauler syndrome, that there are about 10%, I think, and again, this is anecdotal, but there's more and more evidence now about up to 10% of people have long hauler syndrome, which is, you know, side effects, up to 100 different side effects that are awful, that can be awful, can be mild, or it can be you know, really debilitating. And so again, you know, we think about COVID as in, I don't want to die. Of course you don't, but you also don't want to live with some of the side effects that a lot of people are now living with for long term. So there's so many different things to consider, and it is very confusing. And so I think talking to a doctor, a midwife, gathering information, it's smart, and we so appreciate all the questions, because, you know, people are thinking, and that's really, really important.
Thank you so much, Dr. Borders. So it looks like we do actually have one more question. Could you repeat your response to whether or not the vaccine can affect fertility? I have a daughter who is concerned because she has heard the rumors.
I've looked a lot to try to find out where this particular set of rumors has come from, and I haven't been able to find a specific source, but my review of the information that is available to us and my understanding of how the vaccines work really allows me to say that we have no evidence that there is any effect on fertility by having the vaccine. And I would have a much more concern towards the effects of being infected with COVID and those long hauler symptoms with fertility.
Thank you very much. All right, I think that is all of our questions. I don't see any more. So with that, thank you so much, Dr. Quiner and Dr. Borders, for your engaging and informative presentation. I'd like to also thank all of our participants that have joined us this evening for your interest and your thoughtful questions. We know that you may continue to have more questions after this evening, and we encourage you to visit our website, hsc.unm.edu/COVID-19, where you can continue to learn more about this topic. At UNM Health, every minute, every day, your health is our sole focus, and the only teaching hospital in New Mexico, UNM Health providers breathe life into our mission, which is delivering high quality, accessible healthcare to all New Mexicans. And so again, I'd like to thank you all for being with us this evening, and I would like to wish everyone a wonderful evening. So thank you very much.
Thank you.
Thank you.